Hi, my name is Paige and I'm your occupational therapist.
Okay.
I'm going to be looking at your elbow extension today.
Okay.
And we're just going to be doing some tests to look at your strength with manual muscle testing.
Okay.
And your range of motion with the goniometer here.
Okay.
So do I have your permission to perform those?
Yeah, of course.
Okay, perfect. So what I'll have you do first is we're going to see if you can perform the motion with an active range of motion.
Okay.
So I want you to copy my motion. So we'll start up at the shoulder by bending, and I'll just have you straighten out the arm. Perfect. And I don't see any compensations with her movements, so we're free to go to the goniometer. So I'm going to bend down for my body mechanics, and what we'll do is have the patient with their humerus adducted and their forearm is in neutral rotation and supinated. And so what we're going to do is palpate for their lateral epicondyle of the humerus, which is right here. And the axis of the goniometer will be placed here. And the stationary arm will be parallel with the midline of the humerus. And our movable arm will be following the radius, so it's parallel to the radius. So we'll have the client move their arm downward into extension. And it looks like she has a bit of hyperextension here. And she has about 15 to 16 degrees of hyperextension. And while we're in this position, we're going to do passive range of motion with her to see if she has any more extension or hyperextension. So I'm just going to move you and let me know if it hurts. And we got about 5 more, so she's at about 22 here of hyperextension. And normal range for elbow extension is 0, so she is a bit hyperextended. Now we're going to be doing manual muscle testing. So we're going to be looking at her strength for elbow extension. So what I'll have her do first is the motion. So I'll have you start with your hand up at your shoulder, and we're just going to move down into extension. Okay, so she has full range of motion, so we will continue with this against gravity screen, and this is for grades 3 and above. So first, your client will be sitting, and what we're going to have her do is put her shoulder into full flexion, and her elbow will be flexed at 45 degrees. So this is our test position. And I'm going to stabilize at her humerus, and we will be applying pressure at the distal end of the forearm into elbow flexion, and she will be pushing, resisting me into elbow extension. So don't let me move you, I'm just going to push down. So after applying quite a bit of pressure, I would rate her as a 5. So if the client is unable to perform full range of motion in the against gravity position for elbow extension, we're going to move them into a gravity minimized position for elbow extension. So what we'll do is have your client in sitting position, and she will have her shoulder 90 degrees flexed, and the elbow will be in mid position. And we're just going to support her arm here and move her through the range of motion twice to see if she has full range of motion, and you can relax. And so since she has full range of motion, I'm going to go on to the pressure. So instead of mid position this time, she's going to be at 90 degrees of elbow flexion. And we're just going to be supporting her elbow here, stabilizing it. And then we're going to apply pressure perpendicular to her forearm, and it will just be slight pressure. And because she is able to withstand the pressure, I would rate her at a 2+. And if she's not able to withstand the pressure or perform full range of motion, then we will move on to the 1 range where there's no motion present. So we'll have her in this position again, and this time we're going to be palpating to see if there's any contraction present while she's trying to move in the extension motion. So what I will be palpating for is her tricep tendon on the back of her elbow here, and then the tricep muscle belly in the mid-dorsal area of her humerus. And so we'll pick one of those, and I'll do the tricep tendon, and I'll have you try to move. And because she can't move, and there is a contraction, that would be rated trace as a 1, and if she is not able, or if there's no contraction, she is at a 0.